NHA Medical Assistant High-Yield Questions. Question 1. A Billing and Coding Basics Study Note highlights compliance audit. Which definition matches? Option A. A payer check comparing a service with the reported diagnosis. Option B. The code describing a provider's classification and specialty. Option C. The code element added to a procedure code to communicate a special circumstance. Option D. A review comparing coding and billing with documentation and rules. The correct answer is option D. A review comparing coding and billing with documentation and rules. Compliance audit means a review comparing coding and billing with documentation and rules. It identifies errors and supports corrective education. Medical necessity audit means a payer check comparing a service with the reported diagnosis. Taxonomy code means the code describing a provider's classification and specialty. Modifier means the code element added to a procedure code to communicate a special circumstance. Question 2. Why is draping the site without contaminating the sterile field appropriate when skin preparation is complete? Option A. Improves antiseptic action and reduces fire or skin-injury risk. Option B. Creates a sterile working area while exposing only the procedure site. Option C. Creates a traceable record of care, materials, and patient response. Option D. Holds tissue aside to improve visualization. The correct answer is option B. Creates a sterile working area while exposing only the procedure site. Draping the site without contaminating the sterile field creates a sterile working area while exposing only the procedure site. Allowing the skin antiseptic to dry improves antiseptic action and reduces fire or skin-injury risk. Documenting the procedure assistance and specimen handling creates a traceable record of care, materials, and patient response. And recognizing a retractor as an exposing instrument holds tissue aside to improve visualization. Question 3. Which option accurately defines veracity in the area of medical law and ethics? Option A. Improper termination of a provider-patient relationship without reasonable notice or continuity. Option B. The ethical duty to communicate truthfully. Option C. A minor legally treated as an adult for relevant decisions. Option D. The ethical principle respecting a patient's informed choices. The correct answer is option B. The ethical duty to communicate truthfully. Veracity describes the ethical duty to communicate truthfully. It supports trust and informed decision-making. Abandonment describes improper termination of a provider-patient relationship without reasonable notice or continuity. Emancipated minor describes a minor legally treated as an adult for relevant decisions. Autonomy describes the ethical principle respecting a patient's informed choices. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. What is the main reason to protect backup media and recovery systems when the practice plans for a technology failure? Option A. Preserves the audit trail and shows when the information was added. Option B. Activates containment, risk assessment, and notification procedures. Option C. Reduces risk of credential theft and malware. Option D. Supports restoration while keeping protected information secure. The correct answer is option D. Supports restoration while keeping protected information secure. Protect backup media and recovery systems because it supports restoration while keeping protected information secure. Using a late-entry process rather than backdating preserves the audit trail and shows when the information was added. Reporting a suspected electronic data breach immediately activates containment, risk assessment, and notification procedures. And reporting suspected phishing messages reduces risk of credential theft and malware. Question 5. Within insurance fundamentals, which description best explains referral? Option A. A complete accurate claim that can be processed without additional information. Option B. The regular amount paid to maintain insurance coverage. Option C. A formal direction from one provider to another service or specialist. Option D. The person whose enrollment establishes the insurance policy. The correct answer is option C. A formal direction from one provider to another service or specialist. Referral refers to a formal direction from one provider to another service or specialist and may be required by some plans before specialty care. Clean claim refers to a complete, accurate claim that can be processed without additional information. Premium refers to the regular amount paid to maintain insurance coverage, and subscriber refers to the person whose enrollment establishes the insurance policy. Question 6. Which safety or quality benefit comes from applying a sterile dressing after closure when the procedure is complete and the wound is dry? Option A. Preserves awareness of hand position and reduces contamination. Option B. Protects the site from contamination and absorbs limited drainage. Option C. Provides controlled tissue handling according to forceps type. Option D. Preserves specimen identity before it leaves the room. The correct answer is option B. Protects the site from contamination and absorbs limited drainage. Apply a sterile dressing after closure because it protects the site from contamination and absorbs limited drainage. Keeping hands above waist and in view when scrubbed preserves awareness of hand position and reduces contamination. Recognizing forceps as grasping instruments provides controlled tissue handling according to forceps type, and labeling a biopsy specimen in the patient's presence preserves specimen identity before it leaves the room. Question 7. The assistant plans not to place objects in the mouth during a seizure after noting that a convulsing patient has clenched teeth. Which reason supports this step? Option A. Avoids dental trauma, aspiration, and staph injury. Option B. Speeds emergency referral and informs time-sensitive treatment decisions. Option C. Initiates rapid help while determining the need for resuscitation. Option D. Addresses bronchospasm while determining whether emergency escalation is needed. The correct answer is option A. Avoids dental trauma, aspiration, and staph injury. Do not place objects in the mouth during a seizure. This avoids dental trauma, aspiration, and staph injury. Using a stroke-recognition tool and note symptom onset time speeds emergency referral and informs time-sensitive treatment decisions, while assessing responsiveness initiates rapid help while determining the need for resuscitation. Assisting with a prescribed rescue inhaler addresses bronchospasm while determining whether emergency escalation is needed. Question 8. After recognizing that a patient of reproductive potential may undergo testing or receive medication, why should the assistant ask about the last menstrual period when clinically relevant? Option A. Helps identify possible pregnancy and supports safe planning. Option B. Identifies changes that can affect risk assessment and clinical decisions. Option C. Can reveal transportation, financial, language, or caregiving problems that affect adherence. Option D. Improves accuracy and avoids relying on untrained family members. The correct answer is option A. Helps identify possible pregnancy and supports safe planning. Asking about the last menstrual period when clinically relevant helps identify possible pregnancy and supports safe planning. Updating medical, surgical, family, and social history identifies changes that can affect risk assessment and clinical decisions. Identifying barriers to care during intake can reveal transportation, financial, language, or caregiving problems that affect adherence, and using a qualified medical interpreter when needed improves accuracy and avoids relying on untrained family members. Are you looking for NHA Medical Assistant Exam actual questions? Visit our website pokerexams.com to access NHA Medical Assistant Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get NHA Medical Assistant Exam answer key today. Question 9. Within CLIA and laboratory quality, which description best explains analytical error? Option A. Documentation of scheduled instrument cleaning and service. Option B. The certificate permitting a site to perform only waived tests. Option C. An error occurring during the actual testing process. Option D. A limited microscopy category performed during a patient visit by an authorized provider. The correct answer is option C. An error occurring during the actual testing process. Analytical error refers to an error occurring during the actual testing process and can result from instrument, reagent, calibration, or operator problems. Maintenance log refers to documentation of scheduled instrument cleaning and service. Certificate of waiver refers to the certificate permitting a site to perform only waived tests, and provider-performed microscopy refers to a limited microscopy category performed during a patient visit by an authorized provider. Question 10. AHIPAA Privacy and Security Review uses the term serious threat disclosure. Which description is accurate? Option A. Information shared in good faith to prevent or lessen a serious imminent threat. Option B. A concern a patient may submit without retaliation. Option C. A limited secondary disclosure occurring despite reasonable safeguards. Option D. Policies and management processes for security. The correct answer is option A. Information shared in good faith to prevent or lessen a serious imminent threat. Serious threat disclosure means information shared in good faith to prevent or lessen a serious imminent threat. It may be directed to persons able to reduce the danger. Privacy complaint means a concern a patient may submit without retaliation. Incidental disclosure means a limited secondary disclosure occurring despite reasonable safeguards. Administrative safeguard means policies and management processes for security. Question 11. When the patient begins a timed urine collection, why should the assistant discard the first void at the start of a 24-hour collection? Option A. Supports assessment of transport delay and analyte reliability. Option B. Ensures compatibility with the organism or molecular method. Option C. Provides lower respiratory secretions instead of oral fluid. Option D. Empties the bladder so all urine produced during the measured period is included. The correct answer is option D. Empties the bladder so all urine produced during the measured period is included. Discarding the first void at the start of a 24-hour collection starts the timed collection with an empty bladder. Recording collection date and time supports assessment of transport delay and analyte reliability. Using the correct swab type for the requested test ensures compatibility with the organism or molecular method, and obtaining sputum from a deep cough rather than saliva provides lower respiratory secretions instead of oral fluid. Question 12. Why is demonstrating a skill and requesting return demonstration appropriate when a patient must learn home glucose monitoring? Option A. Adds visual support for anatomy, equipment, or procedural steps. Option B. Promotes timely response to severe pain, bleeding, breathing difficulty, or other red flags. Option C. Supports behavior change through respectful evidence-based assistance. Option D. Confirms the patient can perform the procedure safely. The correct answer is option D. Confirms the patient can perform the procedure safely. Demonstrating a skill and requesting return demonstration confirms the patient can perform the procedure safely. Using pictures or models when helpful adds visual support for anatomy, equipment, or procedural steps. Identifying symptoms that require urgent care supports prompt care for serious warning signs, and offering tobacco-cessation resources without judgment supports behavior change through respectful evidence-based assistance. Question 13. Which outcome supports positioning the patient supine or according to clinical need when a routine resting 12-lead EKG is ordered? Option A. Identifies wandering baseline related to motion or poor contact. Option B. Minimizes muscle activity and supports standardized lead placement. Option C. Prevents recording the wrong patient or an unrequested procedure. Option D. Prioritizes clinical assessment rather than independent interpretation. The correct answer is option B. Minimizes muscle activity and supports standardized lead placement. Positioning the patient supine or according to clinical need minimizes muscle activity and supports standardized lead placement. Checking for respiratory movement causing baseline drift identifies wandering baseline related to motion or poor contact. Verifying the patient in the EKG order prevents recording the wrong patient or an unrequested procedure. And notifying the provider promptly of concerning symptoms or tracing changes prioritizes clinical assessment rather than independent interpretation. Question 14. What is the main reason to avoid storing patient data on unapproved personal devices when an employee wants to photograph a document for convenience? Option A. Prevents credentials from being issued to the wrong person. Option B. Prevents loss, unauthorized disclosure, and uncontrolled copies. Option C. Improves accuracy and supports timely clinical use. Option D, preserves care and documentation until data can be entered or reconciled. The correct answer is option B, prevents loss, unauthorized disclosure, and uncontrolled copies. Not storing patient data on unapproved personal devices prevents loss, unauthorized disclosure, and uncontrolled copies. Verifying portal identity before activation prevents credentials from being issued to the wrong person. Recording information promptly and objectively improves accuracy and supports timely clinical use. And following downtime procedures during an outage preserves care and documentation until data can be entered or reconciled. Question 15. How does selecting needle length based on route, site, and tissue depth help when two patients of different body sizes need the same vaccine? Option A, improves control and accurate depth during entry. Option B, permits identification of local reactions and avoids overlapping sites. Option C, supplies required information about benefits and risks before administration. Option D, improves delivery to the intended tissue layer. The correct answer is option D, improves delivery to the intended tissue layer. Select needle length based on route, site, and tissue depth because it improves delivery to the intended tissue layer. Stabilizing the skin and target tissue improves control and accurate depth during entry. Spacing multiple injections permits identification of local reactions and avoids overlapping sites. And providing the current vaccine information statement before vaccination supplies required information about benefits and risks before administration. Question 16. Which safety or quality benefit comes from coaching a patient through spirometry with a tight mouth seal when pulmonary function screening is being performed? Option A, improves validity by preventing air leakage and incomplete effort. Option B, exposes the rectal area while maintaining relative stability. Option C, supports comfort, professionalism, and risk management. Option D, moves fluid away from the opposite eye and lacrimal duct. The correct answer is option A, improves validity by preventing air leakage and incomplete effort. Coaching a patient through spirometry with a tight mouth seal improves validity by preventing air leakage and incomplete effort. Using the SIMS position for a rectal examination or treatment exposes the rectal area while maintaining relative stability. Offering a chaperone supports comfort, professionalism, and risk management, and directing eye irrigation from the inner to the outer canthus moves fluid away from the opposite eye and lacrimal duct. Question 17. A billing and coding basics review uses the term taxonomy code. Which description is accurate? Option A, the claim link connecting a procedure to a supporting diagnosis. Option B, a review comparing coding and billing with documentation and rules. Option C, the code describing a provider's classification and specialty. Option D, the payer deadline for submitting a claim. The correct answer is option C, the code describing a provider's classification and specialty. Taxonomy code means the code describing a provider's classification and specialty. It supplies payer information about provider type. Diagnosis pointer means the claim link connecting a procedure to a supporting diagnosis. Compliance audit means a review comparing coding and billing with documentation and rules. Timely filing limit means the payer deadline for submitting a claim. Question 18. After recognizing that a test requires a concentrated routine urine specimen, why should the assistant collect the first morning urine when ordered? Option A, provides a specimen that has remained in the bladder and is often more concentrated. Option B, prevents introduction of external microorganisms. Option C, supports assessment of transport delay and analyte reliability. Option D, reduces contamination from skin and urethral flora. The correct answer is option A, provides a specimen that has remained in the bladder and is often more concentrated. Collect the first morning urine when ordered. This provides a more concentrated specimen. Not touching the inside of the sterile container prevents introduction of external microorganisms. Recording collection date and time supports assessment of transport delay and analyte reliability. And providing clean-catch midstream urine instructions reduces contamination from skin and urethral flora. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, Scan the code or tap the link in the description and let's get it done. Question 19. In this situation, the calibration mark is reviewed before recording. Why is confirming standard gain of 10 mm per millivolt appropriate? Option A. Ensures waveform height represents voltage accurately. Option B. Ensures time intervals can be measured using standard calibration. Option C. Preserves traceability for interpretation and comparison. Option D. Reduces alternating minus current artifact from nearby equipment. The correct answer is option A. Ensures waveform height represents voltage accurately. Confirm standard gain of 10 mm per millivolt because it ensures waveform height represents voltage accurately. Confirming standard paper speed of 25 mm per second ensures time intervals can be measured using standard calibration. Labeling and save the tracing with patient and acquisition information preserves traceability for interpretation and comparison, and moving electrical cords away from interference sources reduces alternating minus current artifact from nearby equipment. Question 20. Which result is expected from collecting blood culture bottles or sterile tubes first when several venous specimens include blood cultures? Option A. Fills tubing dead space so the coagulation tube reaches the proper volume. Option B. Reduces anticoagulant carryover into serum testing. Option C. Minimizes contamination and additive carryover into sterile cultures. Option D. Accounts for air in the tubing and the manufacturer's collection method. The correct answer is option C. Minimizes contamination and additive carryover into sterile cultures. Collecting blood culture bottles or sterile tubes first minimizes contamination and additive carryover into sterile cultures. Drawing a discard tube before a light minus blue tube fills tubing dead space and protects the required citrate volume, while collecting serum tubes before heparin and EDTA tubes reduces anticoagulant carryover into serum testing. Following the blood minus culture bottle sequence specified for the collection device accounts for air in the tubing and the manufacturer's collection method. Question 21. When a chemistry tube appears pink to red after centrifugation, why should the assistant inspect a specimen for hemolysis? Option A. Distinguishes plasma containing clotting factors from serum after clotting. Option B. Identifies red minus cell rupture that can alter multiple analytes. Option C. Avoids scratching optical surfaces with ordinary tissue. Option D. Verifies that the system is performing within acceptable limits. The correct answer is option B. Identifies red minus cell rupture that can alter multiple analytes. Inspecting a specimen for hemolysis identifies red minus cell rupture that can alter multiple analytes. Recognizing plasma as the liquid from anticoagulated blood distinguishes plasma containing clotting factors from serum after clotting. Using lens paper to clean microscope optics avoids scratching optical surfaces with ordinary tissue, and running required quality controls before reporting patient results verifies that the system is performing within acceptable limits. Question 22. A basic pharmacology study note highlights corticosteroid. Which definition matches? Option A. A medication that reduces nasal mucosal swelling. Option B. A medication used to relieve pain. Option C. A medication that reduces pain, fever, and inflammation. Option D. A medication that suppresses inflammation and immune activity. The correct answer is option D. A medication that suppresses inflammation and immune activity. Corticosteroid is a medication that suppresses inflammation and immune activity. It can reduce swelling and inflammatory symptoms but may have systemic effects. Decongestant is a medication that reduces nasal mucosal swelling, while analgesic is a medication used to relieve pain and nonsteroidal anti-inflammatory drug is a medication that reduces pain, fever, and inflammation. Question 23. During medical terminology review, the assistant encounters hypertension. What does this term mean? Option A. Abnormal accumulation of fluid in tissues. Option B. Vomiting of blood. Option C. Persistently elevated arterial blood pressure. Option D. Located farther from the point of attachment or origin. The correct answer is option C. Persistently elevated arterial blood pressure. Hypertension is persistently elevated arterial blood pressure. It increases long-term risk for cardiovascular, renal, and neurologic disease. Edema is abnormal accumulation of fluid in tissues, while hematmesis is vomiting of blood and distal is located farther from the point of attachment or origin. Question 24. What is the main reason to connect eligible patients with home health services when a homebound patient needs skilled follow-up care? Option A. Supports coordinated symptom management and family services. Option B. Allows connection with resources that may improve access. Option C. Extends authorized clinical support into the home. Option D. Supports population health and reduces missed preventive care. The correct answer is option C. Extends authorized clinical support into the home. Connect eligible patients with home health services. This extends authorized clinical support into the home, explaining the role of hospice when ordered and appropriate supports coordinated symptom management and family services. Identifying transportation barriers allows connection with resources that may improve access, and maintaining a preventive care recall system supports population health and reduces missed preventive care. Question 25. How does clarifying an order that is illegible or ambiguous help when the written dose could be interpreted in two ways? Option A. Prevents guessing when the prescriber must resolve uncertainty. Option B. Reduces contamination of supplies in the patient contact site. Option C. Straightens the pediatric ear canal according to age-based anatomy. Option D. Creates an accurate record and prevents duplicate dosing. The correct answer is option A. Prevents guessing when the prescriber must resolve uncertainty. Clarify an order that is illegible or ambiguous because it prevents guessing when the prescriber must resolve uncertainty. Performing hand hygiene before preparation and administration reduces contamination of supplies in the patient contact site. Pulling the young child's pinna downward and backward for ear drops straightens the pediatric ear canal according to age-based anatomy, and documenting administration immediately after it occurs creates an accurate record and prevents duplicate dosing.